Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A brilliant study was published in the journal Cell Reports in April of 2018 that helps explain the strong association between eating the typical high-fat North American diet, being overweight, and increased risk of colon cancer, breast cancer, and pancreatic cancer. Now, the study also explains why being overweight and eating a high-fat diet are not linked to the increased risk of lung cancer that we see in human observational studies. So this study is really important because colon cancer is the second leading cause of cancer death in our society when you combine statistics for men and women. Breast cancer is a leading cause of death in women, and pancreatic cancer is the 10th most common diagnosed cancer in the United States, and it has a very poor prognosis in most cases. So here's how the story unfolds. We know that cancer develops in stages. Now, in the very first stage, a normal cell in the body becomes transformed into a cancer cell. This is known as the initiation stage of cancer. Now, the transformed malignant cell can sit there idly for many years without dividing rapidly into a malignant tumor. It can just sit there hiding in the weeds for many years, sometimes 10 to 25 years, before proliferating into a malignant mass, or it may never produce a tumor at all. But in many cases, however, the transformed malignant cell starts dividing after a period of time, forming a malignant tumor. When this happens, it's referred to as the tumor promotion stage. Then, the tumor cells can spread through the lymphatic system or the bloodstream to other areas of the body, and this is called tumor progression or metastasis. Malignant tumors can also invade tissues that are adjacent to them and start new tumors there. This is known as also in the progression stage. So prostate cancer can directly invade the bladder. Breast cancer cells can directly invade the chest wall, which is sitting next to them. So it doesn't always travel through the bloodstream or the lymphatic system. But over the years, many studies have revealed the mechanisms through which being overweight promotes tumor promotion and malignant progression. So mechanisms like creating oxidative stress and chronic inflammation and dysbiosis and hormonal alterations, all related to being overweight. And this promotes the tumors to progress, but it's remained unclear as to how a high-fat diet and being overweight actually caused the first stage of cancer, the initiation stage. And so that's what this study explored. So the study in Cell Reports in April 2018 sheds some light on this process. So what the researchers revealed is that normal colon cells and normal breast cells and normal pancreatic cells can sense when a malignant cell is starting to form in their neighborhood. We didn't know this before. And without the help of the immune system, the healthy normal cells in the neighborhood can identify that there's tumor cells forming, and they can exert their own anti-tumor activity and eliminate or eradicate the cells before they can cause any serious damage. So this process has been termed epithelial defense against cancer, or EDAC as we refer to it. Now, these researchers went on to show that in the presence of being overweight or the regular consumption of a high-fat diet, healthy normal colon, breast, and pancreatic cells were unable to eliminate or destroy the emerging malignant cells. So when the diet was high in these bad fats, or there was an overweight was present, or there's obesity, then the normal cells cannot as well identify those emerging cancer cells and get rid of them. So they went on to show that certain fats, especially saturated fats, and the omega-6 fat known as linoleic acid, which accounts for 7% of all the calories in the North American diet, were the worst offenders, suppressing the ability of healthy cells to eliminate malignant cells in their vicinity. Now, many vegetable oils are high in linoleic acid, and that's why most health experts suggest that you use extra virgin olive oil or canola oil, which are rich in the health-promoting monounsaturated fat, oleic acid, as an alternative to the use of most vegetable oils. Now, the study also showed the protective effect of flaxseed oil, which increased the ability of healthy cells to eliminate transformed malignant cells in their vicinity. Flaxseed oil is rich in the omega-3 fat known as alpha-linolenic acid. Now, the high-fat diet, mostly containing the undesirable saturated fats and omega-6 fats, also promoted inflammation, and the omega-6 fat linoleic acid increased the production of a specific local hormone called prostaglandin series 2 that's known to promote cancer development via several mechanisms. Now, the intake of omega-6 was also associated with greater infiltration of inflammation-promoting fibroblasts and macrophage cells, which are all linked to increased cancer development as well. Now, providing mice with aspirin, which blocks the conversion of omega-6 fats into prostaglandin series 2, helped to decrease the number of malignant transformed cells. So I routinely take a supplement each day that contains curcumin and some other natural anti-inflammatories that block prostaglandin series 2 synthesis for this reason, but that's another subject altogether. Now, this study also showed that saturated fats gave the malignant transformed cells an available source of energy that increased their energy production and their cell survival capacity. So these bad fats also, particularly the saturated fat, helped the cancer cells that were forming get more energy so they could actually survive and proliferate. And another observation was that the high-fat diet did not inhibit the ability of lung cells to continue to eradicate transformed malignant cells, which is consistent with the finding that in human studies, human high-fat diets and obesity don't appear to increase the risk of lung cancer. Whereas for breast cancer, colon cancer, and pancreatic cancer, the high-fat diet and being overweight tends to suppress the ability of the normal cells to eradicate any malignant cells that are forming. But in the lungs, doesn't seem to be the case. So the researchers concluded, our work demonstrates that obesity can profoundly influence competitive interaction between normal and transformed malignant cells, providing insights into cell competition and cancer preventive medicine. So here's my take. Studies indicate that at least 70% of colon cancer and 50% of breast cancer are linked to faulty dietary and lifestyle practices. This was published in the Journal of the National Cancer Institute by Dr. Walter Willett from Harvard University back in 1996. The evidence is very strong to show this. Now, the high-fat North American diet, rich in saturated fats and the wrong kind of polyunsaturated fats, linoleic acid and from vegetable oils and arachidonic acid from beef and pork products, as well as trans fats, they're all strongly linked to the development of many cancers that we face in modern society. Consuming saturated fat is also strongly linked to being overweight and risk of obesity. So the study in the April 2018 issue of Cell Reports helps us understand how these bad fats, as well as being overweight, undermines the ability of normal healthy cells to eradicate any malignant cells that are emerging in the vicinity within the colon, the breast, and the pancreas. Failure to eliminate these malignant cells paves the way to cancer promotion and cancer progression at a later date, especially if these dietary and lifestyle practices remain in place to propel the stages of cancer forward. So once again, I suggest you strongly consider the following practices. Replace most vegetable oils with extra virgin olive oil, canola oil, or use grape seed oil for stir fries because it has a very high smoke point. You can heat it to higher temperatures. Minimize your intake of animal foods that are high in saturated fat. That would be beef and pork and high-fat dairy products, as well as trans fats and palm oil, and be very careful also with coconut oil. Eat fish twice a week and consider taking an essential oil supplement that contains fish and flaxseed oil. I also like the addition of borage seed oil because it has anti-inflammatory properties. Don't overeat carbohydrates to prevent their conversion into fat and related weight gain that would then ensue from that. And do at least 30 minutes of endurance exercise 4 to 7 times a week, which among other benefits will help you achieve and maintain ideal body weight. So the evidence becomes more convincing over time that regular consumption of the bad fats, as well as being overweight, are important contributing factors to the development of many common cancers, including colon cancer, breast cancer, and pancreatic cancer. So I've included a link to the research paper in the text below. Thanks for watching, and I'll see you next time.